to another episode of the 2020 podcast, Canada's #1 optometry podcast. I am your host, Dr. Harbir Sayan. Thank you so much, guys, for joining me here. As always, I'm truly grateful for all the support and everything you do to help the podcast grow. We are at the JW Marriott in downtown Vancouver at the BC Doctors of Optometry conference, which, as I'm going to say again, is the best conference in optometry in Canada.
Absolutely.
And so make sure you come out here next year and join us. But we're doing a special series of conversations about scope modernization and optimization. And I know we've been talking about this a lot, but we are doing these small segments that I think are going to be really interesting and going to help all of us to understand the importance of scope optimization, because we're approaching them from all these different angles. And so I have an amazing guest here, a returning guest, Dr. Madan, who is the past president of the BC Doctors of Optometry and currently plays a very, very important role as far as scope optimization goes in BC. She is the chair of the Government and Professional Affairs Committee. The committee is, of course, tasked with discussing with stakeholders in the government about the importance of scope optimization and what we are asking for as far as scope optimization goes. So definitely bringing a very important perspective. Thanks for joining me, Manya.
Absolutely. It's
I'm
a pleasure
excited
being here.
Yes, thank you. Okay, so I want to ask, for the person who's tuning into this and said, oh, didn't you do another episode on scope optimization just a week ago with so-and-so guest? Yes, I did. But again, each person's bringing a different perspective and I'm asking different questions to each person, right? So for you, from your perspective as the chair of this committee, what are you seeing as the modern optometrist role 5 or 10 years down the road?
Yeah, I see the modern optometrist to be more than just a refractionist. We are primary healthcare providers. We're primary eye healthcare providers. And I think we are at the front line of eye care when it comes to looking after the patient and their eye health. So I really see optometry playing a greater role in chronic disease management for better outcomes for the patient. So we're not just focused on just the eye, but as overall health of this patient.
Yeah.
And I also see optometrists really taking under their wing, adapting new innovation, adapting AI technology to better diagnose our patients, to better manage our patients, but also really provide this human-centric approach to eye care and healthcare.
Yeah, so definitely leaning more into the healthcare side of things and away from the sort of the perception of just being optical and refraction and all of that. That's certainly going to be in our future, most likely.
Absolutely. I think that the public is going to demand more from us. And I think we need to be ready with, more innovation, more scope, and more education to be able to meet those healthcare needs.
Yeah. So in that vein, what do you think the public and the government don't understand, or what would you like them to know a bit more about optometry to better understand it?
Yeah, what I'd really like them to understand is that optometrists are doctors, right? We are not just people that sell glasses and contact lenses. Right. We are doctors. We manage very important eye conditions that can not only be vision threatening, but can also be threatening to patients' lives. We manage glaucoma, we manage diabetes, we manage ocular cancer. And so these are very, very important conditions that can have a serious implication on patients' quality of life. And that's a really big part of what we do. Absolutely.
I think that's something that gets lost often. Even for us as optometrists, we forget sometimes how much of an impact we can have and actually do continually have on a daily basis. So if we're not preaching that or educating the public on that, there's no reason why they would even understand that we do all these things.
Absolutely. And I think I also really want the government and the public to understand that we see patients for emergency care, that we actively help reduce wait times at emergencies by seeing some of these patients in our clinics.
Yeah, absolutely. I think that's actually a really, really important point, is helping the public and the government understand where optometry fits in the grand scheme of healthcare system and how we can help to reduce the burden, whether it's the cost burden, the wait times, all these other things. And I think, again, it's on us as optometrists to continue to educate.
Absolutely. And I think another key thing that we do as optometrists is actually provide care in rural communities where they don't have easy access to healthcare or ophthalmology. So I think optometrists really play a really big part in those communities as well.
So what do we want to say to our colleagues who are listening to this, watching, to help them kind of get on board? What can we each do to help move our profession in the right direction and lead to scope optimization?
I mean, I think this is such an exciting time with so much innovation and so much education out there. And I think it really starts with us. I want every single optometrist to practice at the highest level of their scope, whatever that means to them. Get involved in pre-care, get involved in post-care, work with other healthcare providers, work with your nutritionist, your dietitian, work with your retinologist, your GP to really provide that cohesive care care to that patient. Once we integrate ourselves within that bigger picture for this patient's overall health and well-being, we really provide a service that's really not matched by anything else, right? And when we're doing that, I think it's really important to tell people what we do. Tell your patient the services you do. Tell other healthcare providers the services that you do. And continue to learn and innovate and bring new technology into your practices so that we are practicing to that highest scope. And I think once we do that, it's so important to then reach out to your local MLA. Tell them why you're so passionate about this, how this can help British Columbians get healthier and remain healthier and protect the well-being of one of our most important senses, our sight.
Of course. I would say some would argue our most important sense, right? And I think that's actually a really great point that you made. Of course, we're going to sit here and say, okay, everybody go speak to your MLA and all of that. But what you said before that was so important is, first, let's practice what we preach, right? Let's all practice to the level that we should be able to practice at currently, and then, educate, or simultaneously educate the public and the government on what we do and why we should be able to do more.
Absolutely. I think it starts with us.
Yeah, it starts with us. That's a nice way of putting it.
Yeah.
So actually, I know that we wanted to kind of talk a little bit more about this specific thing, your role here with the committee and so on, but I think the way you practice is an important thing for us to touch on, going a little bit off script here. But you practice in a way that you are practicing at a high level and advanced scope. And I think that's an important thing for our colleagues to hear too. It's not just coming from the committee telling us to get off our butts and go talk to our MLAs. Like Manya is practicing in a way that I think we can all kind of aspire to practice as well. So if you don't mind, share a little bit on that side.
Yeah, I work, that's so kind of you, but I work in a ophthalmology practice where we are very much integrated into the practice, providing tertiary care, working with GPs, working with other healthcare providers, and really practicing to the fullest of our scope. And I'm so fortunate to be in that situation. I think every patient encounter matters. Every encounter that we have, every decision we make clinically has big implications. So I think every single day we can take a step forward and start to push those boundaries. And not only do we get more satisfaction in what we do, but we also bring such great value. And that's
100%. Yeah. Well, of course, again, it goes back to patients and how much better we can serve our patients. But the fulfillment, I think that's a nice little point too, the fulfillment we get from our career, right? That advancing like this is going to help us bring more fulfillment, more satisfaction. And I think it's sort of a positive cycle, right? Then you feel even better about what you do, then you want to push a little more and continue to grow.
Exactly. It's a great, nice, vicious cycle.
Yeah, positive. Upward.
That's
awesome.
Right.
Anything else you want to touch on? Did we miss anything?
No, I think that's good.
That's it? Good?
Yeah.
Awesome. Okay, well, thank you, Dr. Madan, for being here to share, again, from the chair of the committee's perspective on where we think optometry is going, where we should be heading to. Thank you to the BCDO for giving us the space, physical space here at the JW, but also the platform to share these important conversations and supporting them. And thank you to everybody who's listening and watching the 2020 podcast, Canada's #1 optometry podcast. See you guys in the next episode.